IVF is a form of assisted reproductive treatment. What we do in it is that we stimulate a woman's ovaries so that she produces more eggs. These eggs are then harvested, and in the laboratory they are fertilized with sperm. The embryo that is generated is grown over 3 to 5 days and returned back into the uterine cavity of the woman. And hopefully this results in a pregnancy. In the UAE, IVF is legally permitted for married heterosexual couples, and they can only do IVF using their own eggs and the husband's sperm. When a couple registers for IVF treatment at our center, we require them both to present their passport copies and photographs of each partner. We also need to visualize the marriage certificate. Before a couple starts IVF, we'd like to do blood tests for both partners to rule out any infectious diseases. We might need to do some hormonal investigations. For the woman, we would like to do a pelvic ultrasound scan, and for the husband, a semen analysis. If indicated, we would also provide genetic testing. A usual IVF cycle takes about 4 to 6 weeks. This includes the preparatory process whereby investigations are done, then the ovaries are stimulated, egg collection is performed, and after the embryo transfer, a pregnancy test is done. Typically, IVF treatment involves ovarian stimulation using injections, monitoring the growth of the follicles using some blood tests and ultrasound scan, the actual egg retrieval process. The eggs are then fertilized in the laboratory, embryos are grown and the growth is monitored. Finally, the embryo is transferred into the uterine cavity, and a few days later we do the blood test to establish a pregnancy. We do offer this facility for people living abroad. We request you to send us all your previous lab investigations and ultrasound reports. Based on this, our doctors will send you a protocol of how you can undergo the stimulation in your own country. You could liaise with your local doctor, and we can also instruct him how to stimulate your ovaries and when to do the ultrasound scans. When the follicles are almost ready, we encourage you to come to the UAE because we'd like to do the final scan in the center itself. Once we are sure that the follicles are ready to retrieve the oocytes, we give you the final trigger in the UAE and perform the egg collection 2 days later. Then you would probably need to stay another 5 days after the egg collection so that we can complete the embryo transfer. We try to minimize your stay in the UAE for between 7 and 10 days. IVF treatment typically is not painful. It is certainly a little uncomfortable. When the ovaries are being stimulated and as the follicles are growing, you do feel a little distension and discomfort. The procedure of egg collection is done under sedation and it is not painful at all. Embryo transfer is a painless procedure. Many factors determine the success rate of IVF, but the main factor is the age of the female partner. The younger the woman, the more likely she is to have good quality eggs and embryos, and this is really the most important thing. Other factors may play a role as well, including semen quality, chromosomal abnormalities in the couple. No pregnancy can ever be guaranteed. Yes, egg freezing for unmarried women is permitted in the UAE. We require the written consent of the woman. Apart from that, it's no different from standard IVF. Under current UAE laws, donor egg, donor sperm, donor embryos, all these are not permitted in the UAE. In the UAE, we typically transfer one embryo into the uterine cavity, but under UAE law, we are allowed to transfer up to 2 embryos. depending on the medical history, previous failures, etc. Extra embryos are always frozen if they are of good enough quality. We transfer these embryos at a later date if the woman either doesn't conceive from the initial transfer or wants another baby after a few years. In the UAE, PGT is permitted. It can be done typically for two conditions. One is to rule out genetic diseases in the embryos if such a condition exists in the family. The other situation is when we check to make sure that the embryo is carrying the normal number of chromosomes. This also allows us to choose the gender of the embryo. We normally recommend couples maintain a healthy lifestyle, make sure there's adequate exercise, avoid smoking, drinking, recreational drugs, and essentially just eat healthy. There should be no other requirements. We ensure complete confidentiality and privacy, and as per the UAE health data laws, none of this information can be disclosed. Fortunately, IVF does not carry many risks. During the ovarian stimulation, sometimes a condition can develop which is called ovarian hyperstimulation. Fortunately, we see less and less of this. During the procedure itself and after the procedure, some amount of discomfort is not unusual. This can be covered with painkillers. Very rare problems that exist can be bleeding or injury to the intra-abdominal structures. Typically, IVF medicines are very safe as long as they're used in the appropriate and right dose. Side effects can be temporary and may last for a few days after the procedure, but are not long-lasting. Most insurance treatments do not cover any fertility-related treatments. However, some high-end insurances do allow 1 or 2 cycles of IVF. Yes, you definitely need a visit visa to come here. Our international patient coordinator can help you to find a suitable accommodation during your stay here, depending on where you want to stay and how much you want to spend. Our team of doctors, nurses, and support staff are all qualified to give all the patients the information they require. The doctors will guide them about the treatment itself. Emotional support will be provided by all members of our team. You only have to ask for it.